It is extremely important for all parents to be able to talk about all body parts with their children, all of them. And part of the question is, why is this a difficult situation anyway? Why is it easy to say, oh, we're going to wash your fingers, we're going to wash your toes, we're going to wash your legs, we're going to wash this thing over here, right? Like, why can't you name it? And this is a common problem. Why can't you say vagina? Like, why does that make you so uncomfortable? Why does saying penis make you so uncomfortable? Probably your own parent couldn't say it, right? So if your parent was uncomfortable, you were uncomfortable. Now you continue to be uncomfortable. And it's funny, some people are only uncomfortable about it with their children and other people are uncomfortable about it overall. So how do we shift this and why do we shift this? So one, practice, just start saying it. It will become less awkward when you just say it. And it is so important for our kids to know these things. Like, if we don't name it, how do they have confidence in their body? How do they know who they are fully? When kids are, 2, 3, and 4, they're really comparing themselves to others. How am I like mom? How am I like dad? How am I like teacher? How am I not like my brother or sister? And part of that is differences in bodies. And as they're like comparing it and thinking about it, they have to understand, what are some of the differences? How are we alike? When I grow up, will I look like that? Will I look like this? A big worry for boys is like, oh, my mom had a penis, then it disappeared. Someone took it away. What happened to it? If we're not talking to them, they believe that is true. They believe you had a penis and now it's gone. And if someone took yours away, they might take theirs away. And that is terrifying. But most boys have this worry at some point. So we have to be able to talk about it, because if you're saying, oh, I want my child to be able to come talk to me about anything, but when they're 3 and they say like, whoa, what's happening? My penis is huge right now, and you run away, why would they trust you to handle anything scary? You can't even talk about my body that you look at and change my diaper or wash me or do, but we can't talk about it because you're too uncomfortable. So it's really important that we start putting words to this to increase our ability to have these conversations. It's not just when they're little, right? Okay, so little boys have erections since infancy, right? And initially they don't really have any meaning. It's just something the body's doing. It's not scary or overwhelming, it just is. But as they get older, it has meaning. Why did this happen? I feel excited, now what? And that's like preschool. But what about then when they start masturbating? What about when they have wet dreams? What about when they start having crushes on people? I mean, middle school boys are going to have erections at school sometimes. How do we help them with that if we can't talk about it at all? Then they're stuck managing that on their own. And that is overwhelming. And they feel humiliated and embarrassed, and they don't have someone to go to. I'm sure everyone can remember somebody who had to hold their binder up, and I hope that kid could go home and talk to their mom or dad about it. But if we don't have the opportunity to say hey, we're going to talk about things that might feel a little awkward, it is the parent's job to still talk about things. Did I really want to talk to my parents about getting a period? No, not really. But it was their responsibility to have the conversation with me, because I'm the one who was going to be going through it. So even though it's uncomfortable, it's the parent's job to have the conversations. There is a safety issue. Kids who can identify all of their body parts are less likely to be victimized when it comes to sexual abuse or molestation. Because if someone tried something that feels inappropriate, they know to talk about it. They know from their parents that there are only certain people that can see or touch or, have access to this information, right? So your doctor, your parent, it's not even your babysitters, because at certain ages or in different ways, your babysitter does not get to see you naked. Your babysitter does not get to ask you questions about it. There's very few people who do. So that way, when a neighbor kid or someone else does something that feels icky, right? And it doesn't even mean something happened, but maybe something could have happened. You want your child to be able to talk about it. And if they can name the body parts and say these things really clearly to their parent, they can prevent things from happening in the future. But when kids don't know that other people are not allowed to be touching them, then they allow it because they don't know. They have to learn from you that like, this is confusing. And there is a lot of sex play between kids that's in the normal range. Like when you're 4, it's like, I want to see yours and you look at mine. And like, it's an exploratory thing. And so we don't want to punish that in a way that shames them forever, but we want to be able to talk about it. How do we have these conversations with our kids? Sometimes you need help from a book. That is not unusual. That is not even just for people who are uncomfortable. That can be helpful for anyone, right? There's a book called It's Amazing, and it has all sorts of information. But with those kinds of books, you have to look through them first. You have to make sure you know what your child is learning and think about what should they not learn yet. Like there are age-appropriate ways of learning. There are age-appropriate amounts of knowledge, like giving them a book to learn everything from like body development to, intercourse. That is too much at once. So like, what do you want to share with them? Some people are just like, here's a book. I don't know, just read it and don't ask me any questions here. Now you know something. So we want to do it together. We want to say like, oh yeah, here's this. What questions do you have? The biggest thing to know is sometimes the question they're asking isn't what they're really asking. So you got to clarify. So if they say, I want to know how babies are born, you say, well, what do you think? And they'll tell you something. It could be a whole wide variety of things. And sometimes they just need to know that that's not right. Like, well, I think, this magical thing occurs. And it's like, oh, I could see why you think that. But that's not true. Like, it doesn't mean you have to go into every detail. So sometimes we'll be like, well, my 3-year-old asked about babies, so I told them everything. And now, they're like, well, my kid seems very overwhelmed. Yeah, that's too much. That's too much. You got to figure out what the real question is that they're asking you. Maybe they just want to know if like someone like the tooth fairy comes to give you the baby, right? And you just say, oh, no, I could see how you think that, like Santa and the tooth fairy bring you things, but that's not how people get a baby. And sometimes that is enough. So you want to find out what they're asking. When you go through one of the books, there are pictures, usually they're cartoon pictures. So sometimes they want to know, what is that like in real life? And I always suggest that they look at their own body. I don't think it's necessary to show them your body or like compare nudity among siblings. You can just talk about comparing the cartoon child to yourself and then thinking like, okay, what would that mean for all these other people? But you want to do it together because you don't want them to be, again, left to the imagination, right? If this book is showing a picture of someone laying on top of someone else and that equals sex, well, now when you're snuggling, do they think they're having sex, right? So like you have to be thoughtful in what you're presenting. And sometimes it's too much at once. So doesn't have to be that way. It can be, we think of things as bearable bits of information in age development fashion. So the book, It's Amazing, is one of my favorite ones. It's very comprehensive, but just pick and choose. Okay, they had a question about this. Let's look at that page, right? My husband is better talking about this. Let's let him look at this and they can have this conversation, right? Sometimes it's like tag teaming on different parts about either who's more comfortable or doing it together, because we want it to go well for everyone. So sometimes both parents or however many parents are involved in the family, like sometimes they all have to be involved in some of these conversations. Sometimes parents have two very different ideas about this. And sometimes that's why people will call me, right? Like whether it's about bodies or whatever else, we have two different ideas and we need to figure out a way. And sometimes it's that people are at extremes and like either extreme usually isn't helpful. So how do we come in the middle? And some of that is your own flexibility, right? So like, okay, you want them to know everything. You want them to know nothing. what's a little bit that we can let them know now and like slowly build on that in a way that like people can get comfortable with, right? So maybe a parent isn't comfortable immediately, but how do we get you comfortable with this? So like, you don't want to say penis. How do we just practice that? But yeah, sometimes people are on two different pages and like, it can't be one of us is right and one of us is wrong, because that almost never works no matter what the topic in your house. So it's like, how do we come together? What's a starting point? It doesn't have to be what either one of you wants. It just has to be a way to begin.